I'm a mother and a grandmother, and I know what it's like to have your hands full and your darling children, but I didn't have any health problems like you have. And the complications, and hearing your testimony and how you juggled being a mother and having a full-time job and having to commute 3 times a week just to receive your dialysis is extraordinary to me, because I know what it was like not having a problem. And I'm sorry that that was your reality. I applaud your strength and the grace that you have shown and how you've been taking care of your own health as well as your family simultaneous. And I see them there back there shaking their heads. As a patient who dialyzed in center and now at home, can you compare the experiences? Tell us what was most difficult about making the transition to dialyzing at home.
Being in center, as I mentioned, there were many different parts of it that was very difficult. A lot of the patients, they were very ill and sort of didn't want to be there. So the experience of going to in center compared to going at home, the impact on your emotional health and your mental health is indescribable, and you can't really calculate that. And I also think that having that emotional impact and that mental health impact does have an impact on your health as well. When you feel better about what you're doing, you feel better. And so with being at home, I was able to see an improvement in my health from that standpoint. And then there was also the sense of autonomy and control that you regain of your own life, and that also has a positive impact on how you're feeling about things and how you feel. So that transition has multiple aspects of it that were an improvement on my life.
And even your disposition, because you're not feeling guilty, and you're more at ease of being in control of something that you weren't in control of, especially with the little ones, that you don't have to take that deep breath before you answer because you're cool and you're calm. I'm working on a bill with Congressman Blumenauer that aims to increase access to home dialysis by providing trained professional staff assistant to patients in their home. And the bill will ensure that all patients are given the education and the support that they need to utilize home dialysis if they so choose. I'm glad to hear that staff training helped you to be able to dialyze at home, and I'm hopeful that my bill will help provide coverage for these services to more ESRD patients. Ms. Maddox, share what your experience was like navigating Medicare coverage for your training and dialysis at home.
It was definitely a huge learning experience for me, and a lot that I had to learn on the fly and through trial and error. I learned that Medicare is required for people who are in dialysis for a period of time. So even though I maintained my healthcare coverage and my main my main insurance coverage through my employer, I was still required to have Medicare. And then I learned that I had to, pay a premium for that coverage, even though it wasn't my choice. I also learned that I had to maintain that coverage in order to stay active on a transplant waiting list. These are all things that I had to figure out as I went. There is a financial coordinator that's available, but she wasn't she wasn't able to help me with filing paperwork, visiting the SSA office, waiting in line, being online on the telephone to just get all of that sorted out. So it's a difficult experience, but I understand why I had to do it.
And it had to have been scary, had to have been. And then for you to finally reach that, again, that deep breath of, okay, I'm just gonna follow through and get this done. I just thank you for your answers and for sharing your story and your family, and I hope to introduce the Improving Access to Home Dialysis Act very soon to help patients access this at home. And Chairman, I yield back. Thank you.